In the first video, we talked about a limitation in ankle mobility that could be due to muscles and how to stretch those out. In the second video, we talked about limitation in ankle mobility that could be due to a tight ankle joint itself, which we would call a capsular problem, and how we would go about mobilizing that. The third thing I want to talk about is when it doesn't really look like there's an ankle limitation in the range of motion, yet biomechanically something is off, and typically there's pain or there's some sort of irritation that they're setting themselves up for an injury by compensating in a certain way. So there are ways that ankle motion and dorsiflexion can look normal, but it's really not because it's coming from the wrong joint. So we talked before, we have the talus and we have the tibia here. As we dorsiflex, we want it to do this. If that can't happen, a lot of times what we'll do is we will drop our arches in our feet in order to get a similar motion. So if I don't have the mobility for my tibias to come forward this way, my body can try to get a little bit more ankle motion. Instead of doing this, they'll come by and my arches will drop, which will still allow my tibias to come forward, but it's doing it at the wrong joint. So the motion isn't actually happening at my ankle or my talocrural joint, it's happening at the subtalar joint, which is where the arch drops. So what we do there is we set ourselves up for medial ankle pain or inside of ankle pain. We set ourselves up for plantar fasciitis and a lot of the things that occur pain-wise either in the heel, along the bottom of the foot, or especially on the inside of the ankle, as well as knee problems due to the fact that the knees have this valgus position. So our knee should always be this way when we squat. If the arches drop, to compensate for lack of ankle motion, the knees are going to come in this way. Bad for the knees. So let's talk about what happens when the medial arch drops, when we have compensation there. We talked about how we're going to have medial ankle pain from that, plantar fasciitis, all kinds of things. It's going to throw off the mechanics of your joint. So the way we fix that is we go back to video number 2, where we mobilized the talocrural joint by doing the band around the ankle. So if we increase the mobility of the ankle joint where dorsiflexion is supposed to be coming from, which is the talus and the crural joint, this motion, if we increase that mobility, then we're going to allow that motion to happen at the joint where it should and not have a compensation with the heel drops. So medial ankle pain, inside of the ankle pain, heel pain, plantar fascia pain, knee pain, IT band pain, all those things that you see with someone whose knees aren't quite able to stay out laterally the way they should, and we have some sort of medial knee position. Normally we're looking at an issue of a tight ankle, and we do the band stretch to get that fixed, and follow the band stretch to the joint by the soleus and the gastroc stretch. Normally that will take care of the problem, and then it's just more a biomechanical issue in relearning how to do the squat so that the knees track in the correct position out that way versus dropping this way. Alright, so I hope that is a little bit of an explanation about what kind of things can happen with foot pain that are related to the ankle and what we can do about it.